to see you all here today. My name is Elizabeth Dvergsten-Beauce, and I'm an oncology social worker. And the goal of today's presentation is to provide you with an overview of how to create your own personalized binder, or as it's sometimes called, a cancer handbook. We'll discuss strategies to organize information that you receive so you feel empowered and prepared every step along the way throughout the whole cancer continuum. And just a reminder, as always, if anything from today's conversation brings up questions or concerns that you might have, please, don't hesitate to speak with your healthcare team, or certainly you can reach out to my colleague Michelle or any other team member at Lung Cancer Canada. Oops, let's see here. There we go. So the goal, again, today is to learn how to create your own lung cancer binder. We know that receiving a lung cancer diagnosis can feel very shocking and overwhelming, and it can also feel like a huge overload of information, and you may feel unsure about what to do next. You're certainly not alone. Creating your own personalized lung cancer binder is, or can be, a really important step in managing your or your loved one's care. And it's also really an excellent way to feel, or hopefully to feel, a sense of control and empowerment in a situation that can feel really overwhelming and uncertain at times. In today's presentation, we'll offer and discuss many suggestions of what relevant information to include in your own personalized binder, but please do keep in mind that it's not an exhaustive list. So as you go along, you'll discover information that really is most relevant to you and perhaps not to other people. So we really do encourage you to personalize your binder as much as possible. All right. So part one. So we'll go through these in a few different steps here. Part one really is all about identifying your purpose. So you may have already developed a system of keeping and tracking information. Above all, do what works best for you. Creating a personalized binder like we're discussing today can really serve many different purposes, actually. It can be a streamlined way to track schedules, to keep test results, to write down any questions or concerns you have. It can be a helpful way to prepare for upcoming appointments, to monitor your physical and mental health, including symptoms and side effects, and also to store and keep close to you resources and other information that you receive. All of the information that you receive at the beginning of diagnosis may not be relevant to you in that moment, but holding on to that information in this particular binder that you create can be helpful so you're not searching for it down the road. I've been in those moments before where you're like, oh, I've got this piece of paper somewhere and I kind of know what it talks about, but I can't remember. Searching for it is really hard and it can be frustrating. So keeping it close and keeping it a part of this binder, again, can be helpful. Consolidating information in a personalized binder can help you or your loved ones and care partners and your care team have one central location to access relevant documents that you can share with anyone, including sometimes new healthcare providers also. And then lastly, creating and maintaining a binder like this throughout your cancer experience can really help to keep you as an active person in your own care. Having quick access to information can hopefully feel and be a really empowering experience for you and reduce overall stress and anxiety as well. Part two, getting organized. If you haven't already, grab a pen and paper so you can take some notes today if you'd like. But again, a reminder, this presentation is recorded and will be posted on our website later, so you can always return to it at another time if you don't catch some things that you wanted to jot down. Sometimes the hardest part is knowing where to start, and that can also feel very overwhelming. So here are 3 helpful tips to get started. Number 1, ask for help. This can be a really great, straightforward way that a trusted loved one can help to relieve some of the cancer burden that you may be experiencing. Step 2, know what's currently available to you. So many cancer centers and cancer foundations have these personalized cancer guides available to people living with cancer. They're not disease specific necessarily, but they are geared towards people living with cancer. Sometimes, again, they're quite generic, and other times they include information specific to that cancer center or province. So, one thing that you can do is you can contact your cancer center's patient and family support services department to ask them if they have something like this already available, or you can even do a quick search online. There are usually also hard copies available, so if you don't want to print it off yourself, they can send one in the mail to you. The information presented today that I've put together is a compilation of information from 5 different guides that are out there. They come from BC Cancer, the Alberta Cancer Foundation, Cancer Care Manitoba, the Cancer Centre of Southeastern Ontario, and Princess Margaret Hospital. So those are just some examples of, doing a search online. Those guides are readily available, and you can absolutely, and I would encourage you to check them out. Step 3, get a binder and a 3-hole punch or page protectors. We're getting, down to the nitty-gritty. Gather the materials that you need to put this together. And it can also be helpful, of course, to have access to a computer and printer if you need as well. And a few suggestions of how to approach this information today. I recognize that there's a little bit of irony in all of this. These tips and strategies to create a personalized binder are intended to reduce information overload and overwhelm, and then, of course, to help you feel a sense of control and empowerment in your care. However, I know that we'll cover a lot of information today, and it might feel a little overwhelming. So my advice, take one step at a time, go at a pace that works for you, and start from today. You can always backfill old information at any time, but start from this present moment today, and just do what works best for you. So part 3, the table of contents. We'll go through each of these specifically, but just a quick run through. Section 1, and again, these are just suggestions. It's certainly something that you can personalize in ways that works best for you. So section 1 is about me. Section 2, my cancer care. Number 3, my schedule. Number 4, my results. Number 5, resources and support. 6, managing during treatment. 7, managing after treatment. 8, moving forward. And 9, additional items. So let's start with section 1, about me. So I'm just going to go through and really kind of read off some of these lists about what you can include in these sections. Again, they're not exhaustive lists, and you really can just personalize this in whatever ways you feel most comfortable and that would be helpful for you. So in this About Me section, it really is kind of all about the demographics and medical information. So your name and contact information, including emergency contacts, your birth date, blood type, languages spoken at home, different allergies that you might have, the contact name and contact information for other healthcare providers that are currently involved in your care. So that might be your GP or your nurse practitioner, your pharmacist as well, and any other healthcare professionals that you see. You can also include information if you have additional insurance coverage. It's always just something helpful to have on hand. And other diagnoses or medical or mental health conditions that you have, or current health issues or chronic conditions, pertinent family history, current medications, and this includes both prescription and non-prescription medications, including vitamins, herbal medicines, recreational drugs or substances, anything else that would be important in your care. And then also, another important section that you can include in this About Me part is really under that question of, what else do you want your oncology team to know about you? You are more than your cancer diagnosis, and it's really important to tie that into your cancer care. So that's something that you can include in this section as well. How do you identify? What various roles or hats do you wear? Are you a parent or a caregiver, a partner, a professional? What people are important to you in your life, and who and where do you get support from? Is it family and friends, your community? What physical activity do you participate in? Do you have particular religious or spiritual beliefs? All of this is, relevant information to include in your About Me section. And also, if there are other stressors that you're experiencing in life that might impact your care, financial stressors, family stressors, work things. Again, you don't have to have specific details if you don't want to include all of that, but certainly just even having these kind of questions in that section can be helpful to generate some conversations with your healthcare team. Are there important life events that you're considering when planning treatment? And again, is there any other information pertinent to your care that you feel is important to share? Perhaps mental health like anxiety or depression that you experience, perhaps trauma history, addiction history. Again, you do not need to include the details, but rather just listing some of these points can again be good conversation starters. The next section is all about your particular cancer history. So that would include things all about the cancer diagnosis itself, so the date of diagnosis, the details of that diagnosis, including type and stage of cancer, and if there's any involvement with tumors or lymph nodes or any metastases that you want to note. And then also including information about your cancer treatment plan and progress, including surgery, chemo or immunotherapy treatments, radiation, maintenance treatment information, a list of treatment medications, symptoms and side effects. Those guides that I mentioned before that I've referenced for this presentation today have really comprehensive checklists. So again, I would encourage you to take a look at them because they're really excellent documents that are already created. So we don't need to reinvent the wheel here. It's just about finding what fits for you. And then other information you can include in this section is all about your oncology team. So who is a part of your oncology team? So you include information about your oncologist and your nurse, other people that you have on your team and their phone numbers, and maybe even clinic days. I know in some places there's particular days that different groups are in clinic. So even including that in your binder can be helpful. Also, phone numbers for health links or other provincial health information services is helpful. Emergency room departments. Many guides provide a list of oncology professionals that you might have contact with at some point also. And again, you don't need to have an exhaustive list, but even just knowing who you might be in contact with at some point down the road can be helpful, and also just knowing about what resources are available to you. And then you can include a section about your cancer center or where you go for appointments and care, the address and location. If you have to travel to that cancer center, maybe including a list of places to stay, restaurants, grocery stores, and pharmacies where you can, pick up various items, parking information, a map and directions, and contact information for your cancer center as well. And then also one piece to include here that can be really helpful and sometimes not always kind of at the forefront of a person's mind is the contact information for the Health Information Management or Release of Information Office. So oftentimes, usually, to get your healthcare records, you need to request that they be released to you. So you need to go and either send an email or a request online or go in person to these particular offices. So having that contact information in your binder can be helpful. And then lastly, in this section, what information about your cancer do you need to know and is relevant? Patient educators can provide you with really good and helpful disease-specific information that's trustworthy and relevant. And then also Lung Cancer Canada's website is another great resource to check out. So in this section, all about my schedule or appointments, you'll have an opportunity at each appointment to ask questions and to share concerns and to clarify any confusion or unanswered questions that you have. So preparing for these appointments ahead of time can help you and your loved one to really feel prepared and to get the most out of each visit. So in this section of your lung cancer binder, it can be helpful to include some of the following: appointment schedules, lists of what to bring, questions to ask, as well as tips and ideas of things that can help you to cope with stress and anxiety, as you're waiting for appointments or scan results, things like that. It can also be a helpful thing to include schedules of past appointments as well. You can keep this in list form or calendar form, whatever works for you. And it's also a helpful place to kind of keep track of anything you might need to do before an appointment. So if you need any blood workup or scans, keeping that in this section is helpful too. And then, of course, as you do prepare for appointments, again, take a look at the Lung Cancer Canada website. There's lots of really great lists of questions that can be asked at certain appointments. So if you haven't checked that out before, I would certainly encourage you to take a look at that and keep some of those questions and lists in this section too. And then a list of items to bring to those appointments. This binder, if you have it all put together and have a lot of this information, you've kind of checked off all the boxes. That would include things like your healthcare card, lists of medications, names and phone numbers of contact people, health history, scan results, questions, and then snacks. Of course, that doesn't go in a binder, but what else to bring to appointments? Snacks, something to keep you busy, and a loved one. In the My Results section, you can again include whatever you want in here, but that can be scan and test results, including blood tests, imaging, and then include also the dates that you took those tests, the dates you received those results, any follow-up appointments from them, and then also keep note of the doctor who's ordered those tests, if that's helpful. One of the things that's really helpful about this section is from that historical perspective. Again, compiling everything in one place, like a personalized binder, can be helpful to go and look back at certain things, and it can be a quick reference point to use. In the resources section, that would be keeping contact information for sources of support at your cancer center, including patient navigators, the patient advocate office, psychosocial oncology, where social workers and counselors work, the spiritual care department, patient education, smoking cessation, nutrition, pharmacy, speech language pathology, and then physio and occupational therapies as well. Again, it's not necessarily that you might always need to know this information or ever access all of it, but it is helpful information to have just at your fingertip, I guess, and being able to access it at any point. And then some information in this section all about managing health during treatment. This is, again, a really important section, and I would refer you to those guides that I mentioned earlier, because they have some really excellent tools that can help you to monitor and assess every step along the way. When you think about managing health along the cancer continuum, again, there's understandably a lot of focus on physical health. However, we know that cancer significantly impacts other parts of life as well. So monitoring stress and distress levels in the following areas is really important, and keeping note of that in this binder is helpful. So things like your mental and emotional health, your mood, your affect, any changes that you've noticed. Again, there's really great tools, things that you can print off that can just guide you through all of that. Practical matters, including work, finances, transportation to and from appointments, things where you can jot down thoughts or ideas or questions to ask is again helpful to keep a track in this binder. Informational things. So do you feel that you understand your illness and or treatment? Do you have any questions or relevant information that you want to be shared with you that you haven't had yet? Again, jot those things down in this section. Spiritual health. What is your sense of self? Do you feel connected to your purpose or things that bring you a sense of joy and quality in life? And then social health. This would include, things all about your sense of self within your circle of support. So family, friends, coworkers, community. Do you feel like a burden to others? Or do you worry about anybody in your life? Do you feel a sense of loneliness or isolation? There are worksheets that you can print off that can help keep track of these things that are really meaningful things that you can include in this binder that, again, you can refer to when you're speaking with your oncology team. And then, of course, your physical health, tracking nutrition and your appetite, for example, body movement and exercise, sleep, concentration and memory, breathing, pain, different things like that is really helpful when you're talking to your oncologist. All right, the next section is all about managing health after treatment. So after you've finished treatment or moved on to maintenance treatment, your healthcare team will have a plan for follow-up care. This will include frequency of visits, required follow-up tests, symptoms to watch for, and who to contact if you do have symptoms or concerns. And it's also really important to identify your primary point of contact moving forward. So for example, some care is returned or managed in the community, for example, with your GP, while other care is maintained by your oncologist and cancer center. It's just really important to ask those questions and who is responsible for what, and then keeping track of that in this binder can be helpful. And again, just a reminder that follow-up care plans are very individual. Each person will have their own unique plan, just as every person will have their own unique individual binder that's relevant for them. Moving forward after lung cancer, when you're in the thick of cancer treatment, it's important to stay grounded and inspired by things that bring you a sense of peace and calm, a sense of groundedness, and inspiration to keep moving forward one moment at a time, and also things that you look forward to after treatment is complete or moves on into maintenance mode. Keeping a section of things that just bring you joy and excitement and hope is also a really meaningful part of this binder. Some ideas of what to include: personal photos, inspirational quotes, magazine clippings of things that bring you peace and hope, meaningful moments or experiences that you want to remember. For example, maybe there was somebody that you ran into, or a really helpful nurse or somebody that just really stuck out to you, a time when somebody offered you a kind word. Sometimes those things, as kind of simple or kind of everyday as they might seem, they can be really helpful to remember. And so kind of jot those experiences down in this section. It can be meaningful down the road. And also things that you want to do after treatment or other life goals that you have. Adjusting to the new normal after lung cancer is a process, and it really does take time to adjust. So it can be helpful to include similar lists from other sections to help track and manage changes and experiences post-cancer treatment. And then an additional section, any miscellaneous items that may have not been included in other sections, that can include additional documents such as an advanced care plan, your living will or power of attorney documents. Alternatively, you can create a cover sheet actually that includes a checklist of items that you already have completed, but you might just not put them in this binder. Sometimes, it's just best to keep those in a separate location or a separate binder, but it is helpful though to include a cover sheet so other people, other trusted loved ones, know that you have those items, just not in this particular binder. When we think about storing and maintaining documents, there's just a few things to keep mind of. These binders contain a lot of personal health information, so keeping them in a safe and secure location is very important. And then, keeping your hands on them when you are traveling with them, not leaving them in a car, for example, but just making sure that you know where they are and that they're safe and secure is important. And then let a trusted loved one know where you keep this information as well. Who are you sharing this information with, and do they know where it actually is that you keep it? Revisit your binder on a regular basis to make sure that information has been updated and included when it's available to you. And then lastly, show your binder to your oncologist and GP. This not only can reinforce your active role in your healthcare journey, but it also is just a really important reminder that, there's more to you than just a cancer diagnosis. It's a reminder that, there's a lot of other stuff going on and that you are maintaining your role as an empowered and active participant in your healthcare. So in summary, we know that receiving a lung cancer diagnosis again can just feel really overwhelming and shocking. And the impact of the disease, we know, is burdensome on people living with lung cancer, as well as their loved ones. So throughout the whole cancer continuum, from diagnosis to treatment to moving forward after cancer, you'll receive a lot of information which can feel like a huge overload. If you feel unsure about what to do next, you're absolutely not alone in that experience. Creating your own personalized lung cancer binder is a really important step in managing your or your loved one's care. So get organized, ask for help, identify resources that are currently available to you, such as the patient handbooks, that I mentioned earlier, and then start gathering the relevant materials that you'd like to include. Identify your purpose. Why are you actually creating this binder? How will it help you? Who will use this binder, and who will you share this binder with? Those questions and clarifying those questions can really help to motivate you in this process. And then when it comes to the contents of your binder, as we discussed, there are some really key sections and pieces of information that can be helpful to include. Remember, the contents of your binder might look different than somebody else's, and that's okay. It's meant to be personalized. And then as a reminder, take extra care to properly store your binder and update it as regularly as you need to. And don't forget to share it with trusted people within your circle of support, including loved ones and your healthcare providers. And then lastly, 3 important reminders. Complete one section at a time, go at a pace that works for you, and start from today. Above all, the goal is that your own personal lung cancer binder will help to reduce stress and overwhelm, that it'll help to empower you in your own care journey, and, ultimately just help to keep you organized along the way. So thank you very much for joining us today.